Welcome to Black Health, a weekly talk show discussing medical issues impacting and afflicting South Florida's Black community. Now introducing our host, Dr. Michelle Kirwan Bythewood.
Good afternoon. Thank you so much for joining us today, and welcome to Black Health, a platform to discuss health issues affecting the Black community. I am your host, Dr. Michelle Kirwan Bythewood. I'm a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens. Today, we are talking about an amazing South Florida-based foundation whose goal is to find the cure for stomach cancer. Welcome to the show, Ms. Brittnay Starks.
Thank you so much for having me.
Absolutely. I'm going to take a moment to give our audience a little brief introduction to who you are. Ms. Brittnay Starks earned a bachelor's degree in journalism and a master's in public relations from the University of Miami. She has spent the past 7 years working for Debbie's Dream Foundation, Curing Stomach Cancer, DDF, and currently serves as the communications director. So Brittnay, tell us about Debbie's Dream Foundation.
Certainly. So Debbie's Dream Foundation was started in 2009 by Debbie Zellman. At the time, she was a 40-year-old practicing attorney with 3 small children, a husband, and she was diagnosed with stage 4 terminal cancer. And she was given a very brief time to live, less than 6 months to a year. And to know Debbie is to know that she wasn't one who would lie down easily or take no for an answer. So instead of succumbing to the prognosis, she started this foundation because at the time, there were little to no resources available for people to Google anything about gastric cancer. And to be told that you could die from the disease was something that didn't sit well with Debbie. So she started this foundation in 2009 to be a resource for people going through the journey of gastric cancer. Stomach cancer is one of the top 5 common cancers in America, and it's also the 3rd deadliest. And unfortunately, it's the least federally funded cancer type. And so Debbie's Dream Foundation serves as its mission to help raise awareness about gastric cancer, to raise that it takes to support research for gastric cancer, and also to support and educate the patient and caregiver community. And ultimately, our goal is to help find a cure for this disease.
So what inspired you to join the foundation, and what personal connection, if any, do you have with the cause?
So I actually had an early introduction into cancer causes, thanks to my mother, who's a hairstylist here in South Florida for over 30 years. Her heart was near and dear to those affected by chemotherapy who would lose their hair. So she became a board member of the WCA, which is the Women's Cancer Association of the University of Miami, also a founding organization for the Sylvester Cancer Center here in South Florida. She became a board member when I was 19, and she also made me become a board member. And I did not understand her why. I also didn't understand what she was leading to, but I'm very grateful because it planted early seeds for me to support causes like Debbie's Dream. So as you mentioned, my background is in communications, and right after college, I didn't get a job in communications right away. I worked in education. That's thanks to my late godmother, who I'll talk about shortly. But she worked in education for over 30 years. She was a principal, and she helped me get a job in education. And when I decided in 2016 that I no longer wanted to teach, I wanted to get back to my field of study, which is communications, I found Debbie's Dream Foundation. And Debbie Zellman hired me herself in January of 2017. And at that time, I never knew anyone who had gastric cancer. But she unfortunately passed away in December of 2017. So I had about 11 months to work with her, but they were 11 impactful months where I learned and grew so much and was inspired by her fight. And so 7 years later, from coordinator to now director, I'm very proud of what I do at Debbie's Dream Foundation to help raise awareness for gastric cancer.
So what exactly is your role as communications director? What does that entail?
So communications director, as many people may be aware, in a nonprofit, you wear many hats, but my role pretty much encompasses representing the brand of the organization, keeping everything intact as it relates to aligning with different partnerships, communication, all things communications. I'm the messenger, social media, all of our outreach, anything that helps us get our message across. And lately, I've been a lot more vocal as a spokesperson. I was very fortunate to be able to travel to Madrid, Spain to represent Debbie Strain Foundation on the patient advocacy side for a big conference, the European Society for Medical Oncology, ESMO. And that was a very good experience for me to really practice speaking more about gastric cancer, because I'm always behind the scenes crafting the message and helping with scripts and all the things. So that's what my message, my role entails.
Okay. Well, so let's talk about gastric cancer. What is it for those who may not know what the word gastric means? What is gastric cancer? How common is it?
So gastric cancer is your stomach. The little pin that I'm wearing right now today is symbolic of the stomach. And as you know, that's a part of your digestive system. It helps break down all the food that you eat, and it gets rid of any waste and whatever nutrients your body needs, it absorbs. So gastric cancer is cancer in the stomach. Sometimes it can also include your esophagus, which is your throat junction. So gastroesophageal cancer is also a part of this cancer group that I represent. And it can look like many different things. Unfortunately, there's no strong early screening program here in North America. And so it gets diagnosed late stages, because it can look like acid reflux. It can look like bloating. It could look like, being full when you haven't eaten that much. It can look like gastritis. And so the symptoms are very vague. And unfortunately, while 30,000 Americans will get diagnosed per year with gastric cancer, 80% of them will be diagnosed late stage because it's not easy to detect. And one of the main ways to have gastric cancer detected is through an endoscopy, where they stick the scope with a camera down your digestive tract to monitor and see if there's any abnormalities appearing. So,
yeah. I imagine part of the reason why it's diagnosed such late stage is because these are very common symptoms that people have: indigestion, heartburn, some reflux symptoms. And I think often until the weight loss starts or some other particular signs that are more striking, people ignore or self-treat, or maybe even the doctors treat until something more significant comes along.
absolutely.
What is the foundation's long-term vision for eradicating gastric cancer?
So our long-term vision is ultimately helping to find a cure for gastric cancer. So we do lots of work in relation to funding. We do our own fundraising efforts throughout the year. In the past, we hosted galas, and we would do bruncheons, and we had golf tournaments and comedy shows to help raise funds directly to fund gastric cancer in partnership with the American Association of Cancer Research, the AACR. And they put together a panel of experts who help Debbie Strain Foundation identify the latest research projects by young GI oncologists who are looking to help, explore the area for treatment options and clinical trials. So we also advocate every year, usually in the beginning of the year, for federal funding through the Department of Defense's peer-reviewed cancer research program. And many people don't know, but that particular program is what helps fund different cancer types and allocates research funding from the federal government to those cancer types. And unfortunately, as I mentioned, gastric cancer is the least federally funded, although it is the third deadliest cancer type. And so we look forward to changing that. And so we advocate every year, because if we don't go back to Capitol Hill with patient and caregiver advocates to share those stories with state representatives, we won't be included in the federal budget. And it's unfortunate, but we make it a part of our mission to show up every year for our advocacy day.
Great. So, Brittnay, we're going to take a quick commercial break. For those of you watching, don't go anywhere. When we come back, you'll hear some testimonials as to how Debbie's Dream Foundation has helped those lives that it's touched. We'll be right back.
Miami-Dade Transit's Better Bus Network is shifting into gear. This community-led effort creates better access and an improved rider experience with less wait times and more reliable service. The new network provides more frequent and faster trips to more parts of the county, increasing transit access to jobs, education, healthcare, and quality of life. Learn about the new routes and new connections by visiting miamidade.gov/betterbus.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family. Our future.
The difference we'll make for you, your loved ones, your kids, matters. Because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 8.
Time to find a health plan that can keep up with your life. A plan that makes getting care convenient, with doctors around the corner.
I can get used to that.
Plus, 24/7 access to care. Plans that keep more money in your pocket, with plan payments as low as $0.
$0. Looks good to me.
Let's find your health solution. Click to speak to a dedicated Florida Blue agent today.
When quality care is a priority.
Celebrate food, culture, and family fun at the Grace Jamaican Jerk Festival presented by Publix. November 12th at Miramar Regional Park. Feast on your favorite jerk and Caribbean cuisine. Enjoy live performances by Morgan Heritage, Ding Dong, Carly Buds, Christopher Johnny Daly, Dancing Dynamites, and more. Come for the food, stay for the fun. Kids under 10 free. Tickets at jerkfestival.com. Presented by these fine sponsors.
Summing up everything that DDF does in one word or phrase.
One word or one phrase? Okay, how would I sum up Debbie's dream in one word? That is an extremely difficult answer.
That's a little hard.
If I could sum up in one word what Debbie's Foundation has done, I think it would be awareness.
I would say that they are about persistent patient advocacy.
Collaboration, because they find lots of different people to work with and bring them all together, and that further amplifies our voices.
They've been my lifeline. Power. I'm going to use a word that doesn't probably strike you at first. Appreciate.
It's home.
It's made me aware that my voice matters. I didn't know it did.
It made me feel like I have a voice and I matter.
I'd say the one word would be inspiring.
Yeah.
Yeah, there's hope, community.
Impactful.
Yes, impactful. I would say it is profound.
I think that what Debbie's Dream Foundation does really well is that they're here for everybody.
I would say that inspiration.
Godsend. It's been a godsend. For people who have been diagnosed with stomach cancer and don't know where to go or what to do, Debbie Dreamer's Foundation is a godsend.
Wow, what a beautiful video. Wonderful testimonials for Debbie's Dream. You clearly have touched a lot of lives, and especially when those lives are being touched with something as significant as cancer, any form of cancer, really. So I wanted to ask, in terms of the Black and African American population, is there a higher incidence of gastric cancer in this population? And if there is, why do you think that is?
So there absolutely is a disproportionate statistic when it relates to African American males and females in comparison to non-Hispanic white males and females. So African American males are 1.8 times more likely to be diagnosed with gastric cancer and twice as likely to die than their non-Hispanic male white counterparts. And African-American women have a similar statistic. They're twice as likely to be diagnosed and 2.2 times as likely to die from gastric cancer. So it's unfortunate. And I do think that a lot of it has to do with some of the barriers to health. We know historically in America, specifically African Americans, and our relationship with our bodies, but particularly the healthcare system. There's a lot of distrust there historically. A lot of times we're not doing our due diligence to make sure we stay on top of our annual checkups and, paying attention to the changes that are happening in our bodies. That's one thing. But then there's also just the part where you may be explaining to your doctor you're experiencing certain symptoms, and maybe they don't look further because, unfortunately, the medical field isn't as prepared for cancer types like gastric cancer as they are for breast cancer and other more popular cancer types. So maybe your healthcare provider doesn't know to look further with an endoscopy. So if you show symptoms of acid reflux, you will get the standard, prescription of acid reflux medication. So, there are many, many barriers to health and how these statistics are spread. But Debbie's Dream Foundation, we're doing our part to help close the gap. We recognize that there are disparities in health as it relates to gastric cancer. So we work directly with organizations like the YMCA and the United Way to host workshops where we are giving critical information to minority populations right where they live, right? Because part of the barriers to health sometimes is social economics. Sometimes it's transportation. Sometimes people aren't leaving their communities because they don't have access to transportation. So we recognize simple things like this that aren't so simple. And so our answer to that is to meet the community where they are. Workshops, we give out information, we talk about the statistics, and we often are surprised to learn that a lot of people, sometimes they will know someone who had gastric cancer or at least had some of the symptoms, and it makes them more equipped and educated to talk to their healthcare providers to look further or encourage others to look further and explore whether or not they may be at risk for gastric cancer.
So you mentioned, in talking about the minority communities, you mentioned education. Does Debbie's Dream also provide treatment resources or prevention resources?
So throughout the year, we host a series of webinars. We partner with oncologists from some of the top institutions in the country, and we rely heavily on them to give us the latest information on different treatment options, on clinical trials, basically covering every subject area that could affect a gastric cancer patient. We work directly with them to host webinars throughout the year and also symposia. And so this is our way of helping educate the patient and caregiver community on what they can expect, how they can best advocate for themselves, because knowledge is not power. It's when you have the knowledge and then you're able to use it in a way that benefits you. So if you're going to your doctor knowing certain terminologies, knowing what things to ask for because you watched a webinar or you tuned into our symposia and you feel like you know enough to inquire, your doctor may be impressed because a lot of patients don't have that information. They don't even know where to start. So we're very proud to be able to offer free education throughout the year. We also offer support in the form of a helpline. We have a 1-800 number in partnership with Cancer Care where patients can call and speak to social workers in oncology if they're having a hard time with mental health. We also have a Mind, Body, Spirit series that we do on Facebook Live where we work with practitioners of non-traditional therapies and treatments. We've done Tai Chi, we've done yoga, we've done meditation. So we recognize that there's a wide range of needs for this community. It's not enough to have support just for the cancer, but also for your mental health. That's one of the things that we pride ourselves on as well.
Brittnay, we're going to take a quick commercial break. We'll be right back.
Miami-Dade Transit's Better Bus Network is shifting into gear. This community-led effort creates better access and an improved rider experience with less wait times and more reliable service. The new network provides more frequent and faster trips to more parts of the county, increasing transit access to jobs, education, healthcare, and quality of life. Learn about the new routes and new connections by visiting miamidade.gov/betterbus.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family. Our future.
The difference we'll make for you, your loved ones, your kids, matters. Because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, your accidentattorneys.com.
Time to find a health plan that can keep up with your life. A plan that makes getting care convenient, with doctors around the corner.
I can get used to that.
Plus, 24/7 access to care. Plans that keep more money in your pocket, with plan payments as low as $0.
$0. Looks good to me.
Let's find your health solution. Click to speak to a dedicated Florida Blue agent today.
When quality care is a priority.
Celebrate food, culture, and family fun at the Grace Jamaican Jerk Festival presented by Publix. November 12th at Miramar Regional Park. Feast on your favorite jerk and Caribbean cuisine. Enjoy live performances by Morgan Heritage, Ding Dong, Carly Buds, Christopher Johnny Daly, Dancing Dynamites, and more. Come for the food, stay for the fun. Kids under 10 free. Tickets at jerkfestival.com. Presented by these fine sponsors.
So as I mentioned, I didn't know anyone who had gastric cancer prior to working at Debbie's Dream Foundation, aside from the founder, until 2020, when my late godmother, Cheryl Johnson, was diagnosed suddenly during the pandemic with gastric cancer. She did not have odd symptoms aside from not being able to eat was her main symptom. And so she was treated for a severe case of gastritis. And unfortunately, she got diagnosed in June of 2020. And I didn't find out about it until July of 2020 because she kept it near and dear to her. She was terrified from my understanding, and rightfully so. And unfortunately, she did not last long enough to have chemotherapy. She passed away September 30th of 2020. And so in her honor, I do my part, not only from what I've always been doing at Debbie's Dream Foundation, but having known her story personally to know that she wasn't showing any other risk factors, that doctors didn't know what else to look for. She was always on top of her health. And so in her honor and those we've lost to this terrible disease, we'll continue to raise awareness. We'll continue to help support patients and their families, because people shouldn't die from gastric cancer. They should have a fighting chance. And unfortunately, my late godmother did not. So really appreciate the opportunity to talk about this cancer type and raise awareness around it.
Well, Brittnay, I'm so sorry for your loss. I know that it's tough. Cancer, any type of cancer is really tough. And especially something like a stomach cancer that really kind of sneaks up on you, and it's pretty far along when you get diagnosed. And so it's very difficult. So again, my condolences for your loss. But thank you so much for all that you do and how you take that pain and use it to help other people. Thank you to Debbie's Dream Foundation for all that they do to spread awareness, to help with providing resources for prevention, education, treatment. You're such a valuable asset to the community. So as a physician, it's wonderful to hear about organizations like yours. That we have somewhere we can send patients and we can say, hey, there's a great foundation out there that can give you more support. So again, thank you so much for being here today on Black Health. We appreciate your time, and we appreciate all that you do. Continue to do what you do. Thank you.
Thank you so much for having me.
Absolutely. And we will see you next time on Black Health. Thank you for joining us today. We'll be back.